Development Committee hearing for Monday, April 20th. Welcome. There are no bills proposed for consent today, and we will be hearing all 6 bills before us. The first bill today, and we will begin as a subcommittee, since we don't have a quorum established yet. We will move to item number 2, SB 284, Senator Cannella.
Thank you, Mr. Chairman. Members, I'm here to present SB 284, which will remove, in its original form, remove the sunset date by Senator Alex Padilla, allowing engineers and land surveyors to continue to form limited liability partnerships. 3.4 million California small businesses account for 99% of the state's employers and employ 52% of the workforce. Small business owners know their business best and should have every tool available for them to be successful. Engineers and land surveyors are the foundation for business growth in California and have been recognized for their contributions to our state recently with our resolutions. Extending the same flexibility to form limited liability partnerships as architects will allow engineers and land surveyors to continue to contribute to business and job growth in our state. I will accept the committee amendments and instead of removing the sunset, just extend it for 5 years. And also, if we're concerned about limited liability for professionals, I'm a professional engineer, and when I stamp a drawing, I accept all the responsibility. It doesn't matter what kind of company I have, I'm responsible for that. So this is not to skirt any responsibility. So with that, I'd like to turn it over to the American Council of Engineering Companies as the sponsor.
Thank you, Senator.
Thank you, members. I'm Kelly Garman. I'm with the American Council of Engineering Companies of California. We represent over 800 private engineering and land surveying firms. We just think SB 284 is a good business bill. Like the Senator said, we want to provide every tool that we can for businesses. We want to give them the opportunity and the flexibility to structure the business as they want and they think is best. We think providing options for businesses makes sense, and we ask for your aye vote.
Very good. Thank you. Other witnesses in support? Good afternoon.
Hi. Thank you, Mr. Chair. Don Chinsky on behalf of the Structural Engineers Association of California. Pleased to support.
Thank you very much. Other witnesses in support?
My name is Carol Williams, and I'm with the Board of Engineers, Land Surveyors, and Geologists, and we are in support of SB 284.
Very good. Thank you. Other witnesses? Anyone in support? Are there any witnesses in opposition? Seeing no one. Very good. So we do have a, yes, Senator Mendoza, you had a question? Well, we do. We will establish a quorum. Not yet. So please, Madam Secretary, please call the roll.
Hill?
Here.
Hill here. Bates? Here. Bates here. Berryhill? Here. Berryhill here. Block? Here. Block here. Galgiani? Hernandez? Here. Hernandez here. Jackson? Mendoza? Here. Mendoza here. Wachowski? Okay.
Aye.
Wachowski here?
Here.
Okay.
So we do have a quorum established. Now we do have a motion from Senator Mendoza. And just before we do the vote, I mean, I appreciate your taking the amendments. And I think that in the next sunset, we can maybe eliminate the sunsets. I think it would be appropriate at that point in time to, in my sense, that it's been established, and that will be the second 10 years after the first establishment. So I would certainly suggest that in the future. We have a motion from Senator Mendoza. This is due pass to Committee on Judiciary. Please call the roll.
Motion is to pass and refer to Judiciary Committee. Hill?
Aye.
Hill, aye. Bates?
Aye.
Bates, aye. Berryhill? Aye. Berryhill, aye. Block?
Aye.
Block, aye. Galgiani? Aye. Galgiani, aye. Hernandez? Aye. Hernandez, aye. Jackson? Mendoza? Aye. Mendoza, aye. Wachowski?
Aye.
Wachowski, aye.
Thank you.
8 votes. That bill has 8 votes. It's out. We'll hold the roll open. I'm sorry? It will leave the roll open for the absent members. Thank you. We'll move now to Senator Block will be presenting for Senator Pavley on item number 4, SB 337. Senator Block, good afternoon.
Good afternoon, Mr. Chair, and thank you for permitting me to present on behalf of Senator Pavley. I will read the statement exactly as it's written so I don't get in trouble. Chair and members of the committee, I would like to present SB 337 on behalf of Senator Pavley. SB 337 provides flexibility in the documentation of the supervision relationship between physicians and physician assistants. The Patient Protection and Affordable Care Act resulted in millions of additional people seeking health care services in California. This increase has created an even greater need for high-quality, efficient care across all medical settings. This is especially true for the practice of physician assistants, who are authorized to provide exams, diagnose, and treat illness, and who prescribe medications, all under the supervision of a physician. While the intensity and utilization of the healthcare system has increased over the past decade, the laws have not kept up. Documentation of supervision of PAs is still largely based on a paper records review system. SB 337 considers the growing integration of practice settings and the implementation of electronic medical records to update the methods for documentation of the supervision of PAs. First, the bill continues existing law, which requires physicians to co-sign 5% of medical charts. SB 337 adds the option for physician and PAs to meet 10 times per year for a medical record review meeting where the physician PA review cases. Or the physician and PA can do a combination of review and documentation methods established by the supervising physician. These new options will strengthen the team-based approach by encouraging more active discussion during the records review. And I might add, it's always under the supervision of a physician. It's the supervising physician's call which method to use. SB 337 also addresses an issue of more recent concern. Currently, for Schedule II drugs, physicians are required to sign 100% of the prescriptions within 7 days. Last year, the federal government reclassified all hydrocodone pain medications from Schedule III to Schedule II. This has created a significant administrative burden when these medications are prescribed by a PA. SB 337 would allow a physician to co-sign a minimum of 20% of Schedule II prescriptions if the physician assistant completes a controlled substances course. The supervising physician may require a higher percentage of co-signatures on Schedule II medications in the delegation services agreement. Again, this is at the call of the supervising physician. SB 337 increases the option for documenting supervision between a supervising physician and a PA and allows for greater flexibility at the practice level to reflect current models of team-based care. It does not dilute the supervision of the PA by the physician. The supervision requirements in the supervision agreement can go above the requirements of law and often do when a PA-physician relationship is established. Here with me to testify in support and answer any questions you may have is Jeremy Adler, a physician assistant from San Diego, and Catherine Scott, representing the California Academy of Physician Assistants.
Great. Thank you, Senator Block. You read that very well for Senator Pavley. We'll let her know. You did a good
Thank
job.
you.
Catherine Austin Scott, because the substitute author did such a fabulous job, I'm going to defer to the experience of Jeremy, and I'll be here for any questions.
Thank you very much, Ms. Scott.
Good afternoon, Chair and members. Thank you for the opportunity to speak to you about SB 337, Physician Assistants. My name is Jeremy Adler. For the last 15 years, I have practiced as a PA in pain management, and I have a master's degree specializing in pain management. I hold the designation of a credentialed pain practitioner, and I've participated in updates to the current California Prescription Drug Monitoring Program, CURES. I sit on the San Diego Prescription Drug Abuse Task Force, and I'm currently president of the California Academy of PAs. PAs practice in all areas of medicine. At our professional core, we embrace team-based healthcare and have very close and formal relationships with physicians. In California, PAs are required to have physician supervision. Nothing in SB 337 changes anything related to this supervision requirement. So why is this bill needed? Healthcare is changing, and in order to deliver increased access to high-quality healthcare, the system needs updating. Long ago, when medical records were only paper, California adopted chart co-signature as the only way a physician could document they have met their supervision requirement. Today, more than ever before, a focus on innovation, technology, and novel ways of delivering care to patients means the existing one-size-fits-all approach no longer makes sense for every practice in every setting. In my practice, for example, we have 2 physicians and 3 PAs providing services in 2 outpatient clinics, a freestanding surgical center, and 2 hospitals. Team-based care happens in real time, and PAs are trained from day one how to optimally be team members. Physician supervision is not the same as a co-signature. A co-signature happens at some point later in time after the care is delivered and does not reflect the interactive relationship between PAs and physicians. In our practice to provide the best care, we have adopted medical records review meetings in which all 5 of us providers meet for 2 hours every week to review cases, discuss best practices, and develop consensus for treating our complex patients. Despite the depth and meaningfulness of these meetings and the requirement to supervise and accept responsibility for my care, my supervising physician has no other option than to co-sign the same number of charts as my first day in practice over 15 years ago. In summary, SB 337 will enable flexibility in how physicians document the requirement of PA supervision without changing the mandate to supervise. This flexibility encourages and enhances team-based care for the ultimate benefit of our patients. Thank you for your time, and I'd be happy to answer any questions.
Thank you very much. Are there other witnesses in support? If anyone else would like to speak in support, please be prepared to come up.
Good afternoon, Chair and members. Bill Barcelona, Senior VP for Government Affairs with CAPG Physician Groups. We're in support of this bill.
Very good. Thank you very much. Others in support? Is there anyone here in opposition?
Thank you. Juan Thomas, California Medical Association. Mr. Chair, we're not in opposed. We had to adopt an opposed unless amended position. I want to thank the author and the sponsors. We've been having some productive conversations. I think we're there on the number of medical records review meetings during the year. We're continuing to have conversations about the percentage of the prescriptions that need to be reviewed, but we're very confident that we'll be able to get there. And again, I want to thank the author and the sponsors for having the conversations.
Thank you, Mr. Thomas. I notice there is none on file. You did not send a letter?
We've been negotiating in good faith, and we're confident that we'll get there.
Very good. Thank you very much. Others in opposition? Seeing no one, questions of the author or his witnesses? Seeing none, this would be, yes, I'm sorry, Senator Jackson. Thank you.
I have a painful question to ask. Yes, it's.
I hope so.
Well, no, this is a real quandary for me. This whole area of physicians' assistants and others, nurse practitioners. I totally understand the need for. We've got to do something to provide health care to the millions of people who are now qualified to get it. Of course, we care for them anyway, but it's usually in an emergency room setting, which is a really dumb place. But unless you really need it. But so that being said. And I know I've talked to Senator Hernandez about this, so I'm going to throw this out to you folks and get your thoughts, if I might. You know, to become a doctor, you have to go through some rigorous training, and then you've got clinical work you have to do, and residency, and so forth and so on. And so that's one of the reasons that we give doctors so much power and authority, is that we feel that because of their education, their experience, they're at the highest level of care. You know, not that every diagnosis is accurate, every treatment is appropriate, but that sort of, we have to have a bit of a leap of faith with illness that doctors are the best ones to take care of it. And then we have other levels. And you've got a master's degree. I mean, you've had a lot of training, but you haven't had the same training as a doctor. So my question is, why should we be accepting your treatment when we know that there are those who, theoretically at least, have greater education? You know, you've got an area of expertise, but if I'm not mistaken, at least theoretically, a doctor's supposed to be able to see along a greater totality. And I just think of an incident where when I was practicing law, I had a client who presented herself. She had fallen and went to the hospital, the clinic, and a physician's assistant saw her and gave her some medication. She was obese, actually, as it turned out, and the physician's assistants didn't ask the right question, and blah, 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 blah. She ended up having to have her leg amputated. This was a physician's assistant whose focus in treatment was whatever she had done to this ligament or something when she fell. So if this had been a doctor, it at least was our hope that the doctor would have recognized that she might have been diabetic, which is actually what it was. But because a doctor is sort of this global, or theoretically again, this global training and experience, that would have saved her leg. It's just an example. So why should we be entrusting physicians' assistants to do things that we otherwise would have doctors do under the sort of the umbrella that the job of a physician is to do no harm?
So certainly that I appreciate the question and the opportunity to talk about that. The whole concept of our profession is team-based care. PAs were started by physicians. That is the genesis of our profession, and we're trained in the medical model. It was actually adopted from World War II fast-track training for physicians. So we are trained from day one in the model that physicians train, but we're not released out into the world. We're paired up with physicians and have a very defined relationship. We have a document that has to exist at every practice site that defines the scope of practice that individual physician delegates to us. So by virtue of our license, we're not out there practicing, we're working with a team. That is the concept. And the goal really is to try to expand and increase access. And certainly there are outcomes like you decide across all of the health professions. That's not unique to any one in particular. And the goal of our training programs is to teach PAs when they reach that point where they need at that point in time to work with their physicians, and their physicians are actively involved in their in the care that they provide.
So they are actively involved.
Absolutely.
And how do you define that active involvement?
So it depends. When we get together in our practice, for example, we talk on the phone, we talk in person, depending on which site we're at. We meet every week to talk about cases. We review best practices. We try to standardize the approach. We have protocols that are written to define how we're going to address individual patients. There are many requirements that we have to fulfill in order to be able to provide care. And one of the things that we have seen is the expansion into those areas of medicine where access is compromised. We have a recent report by OSHPD showing that a third of PAs practice in either a medically underserved area or a health care professional shortage area. So we know that we're reaching into communities on these team-based models to areas that don't otherwise have adequate access to any care.
Did you want to add
No,
to
I
that?
did. I wanted to make sure that answered your question. That 337 is actually addresses the supervision piece so that it is in that team-based approach and reflects that supervision model. So I think it's important to focusing on this bill, what we're looking at as how we determine that supervision, how the physician determines that supervision, and actually how the physician can support and promote that supervision in a different way that's more integrated, because the difficulty is today they just sign a chart, and that may be less supervision than we would envision under portions of this bill. So, or less interactive collaboration really is what it is, because it's that, I think all environments that include all health professionals depend on collaboration amongst the professionals that are seeing the patients. I know that's true of every practice I've visited personally. If it wasn't for every professional in that space, we wouldn't get to see, the physicians when necessary. So,
Okay, thank you. I appreciate the comments.
Thank you for the question, Senator Jackson. Other questions? Seeing no one, is there a motion? Entertain a. Yes, thank you, Senator Mendoza. We have a motion due pass to Appropriations Committee, and thank you for that explanation. I think that this allows, in the complementary nature of the profession and the scope that you practice is determined by the relationship that's established, and I think that says a lot. So thank you for doing that. And we have a motion. Please call the roll.
Motion is due pass and be referred to Appropriations Committee. Hill?
Aye.
Hill, aye. Bates? Aye. Bates, aye. Berryhill? Berryhill, aye. Block?
Aye.
Block, aye. Galgiani? Aye. Galgiani, aye. Hernandez? Aye. Hernandez, aye. Jackson? Aye. Jackson, aye. Mendoza? Aye. Mendoza, aye. Wachowski? Aye. Wachowski, aye.
And I apologize that Senator Block could not read Senator Pavley's close.
I was going to, on behalf of Senator Pavley in closing, remind you how important AB 32 is.
Thank you, Senator Block. Was it the vote? 9-0. That bill is out. Thank you, Senator Block, for presenting that on behalf of Senator Pavley.